Welcome to this brief video which will give you the basics of wound suturing aimed for the accident and emergency setting. At the end of this video you should be able to choose an appropriate suture material, choose the appropriate size of suture, and choose a type of needle to close the wound for any type of wound that you may come across. You should also, with appropriate practice, be able to close a wound with simple or mattress sutures. So first of all, suture size. Sutures come in a variety of thicknesses. The size of the suture is denoted by a figure from 1 to 5 with a following 0. So a thick suture would be a 1-0, a slightly thinner suture would be a 2-0, and a fine suture would be a 5-0. In general, the sutures that you will be using would be 3-0 sutures, which are suitable for the trunk and limbs, 4-0 sutures, which are more suited to the hand or finer work, and finally 5-0 sutures, which are very fine and suitable for delicate work such as on the face. Moving on to suture materials, virtually all of the materials that we use now are synthetic materials, and most of the sutures that you would use in the trauma setting or accident emergency setting will be monofilament. That is to say, smooth like a piece of fishing line. Sutures can also be absorbable, that is to say they don't need to be removed, or non-absorbable, that is they will need to be removed at a time period after insertion. So starting with the most commonly used sutures, the synthetic monofilament non-absorbables. And the two types which are most commonly used are Prolene and Ethilon. Prolene is a little bit more difficult to handle. It has some memory, that is to say it's quite springy and can be a little difficult to handle while suturing. It's also very slippy, and you may need 4 or 5 throws on the knot to stop it slipping and coming undone. Ethilon is a much easier suture to handle and is probably the most commonly used one in the accident and emergency setting. Occasionally we may wish to put in an absorbable suture, and the synthetic monofilament absorbable which is available is monocryl. This will be degraded by the body and generally fall out after about 10 days. Finally, there is the synthetic braided absorbable suture, Vicryl, which again is broken down by the body and stays in about 10 days. Vicryl Rapide. The synthetic braided absorbable suture used on the skin is Vicryl Rapide, which is an undyed material, unlike Vicryl, which is purple and can tattoo the skin. This dissolves after about 7 to 10 days. Monofilament sutures are more resistant to infection. You can get bacteria within the braids of a braided suture, which can give more problems with wound infection. So in general, in the accident emergency trauma setting, we would choose a synthetic monofilament non-absorbable. Needles come in a variety of sizes, and generally the appropriate size of needle will already be attached to the suture material. There are, however, a variety of types of needle. The one that you should use for skin is a cutting needle, and you can see this on the packet. It's denoted by a triangle, and it's suitable for very tough tissues because it essentially has a knife on the end of it and will cut through. Round-bodied sutures are denoted by a circle, and this shouldn't be used on skin because it's really too tough. Round-bodied sutures are for use on softer tissues like bowel. If we look at a suture pack, you can see the size of the thread, 3/0. You can see the design of the needle, in this case a reverse cutting needle, and you can see the size of the needle itself, which in this case is 26mm. On opening the pack, you'll be able to get access to the needle, and we're going to take you through how to grasp the needle now. So hold on to the body of the needle about 1/3 of the way along its length with the tip of the needle holders. So you notice that the thread has got what's called memory. It still thinks it's coiled up in the packet. So just stretch it. That makes it much easier to handle. You can, if tissues are very hard, put it there. That's acceptable. Don't mount it right at the end there. Don't mount it there because the needle rotates. Never do that. You will damage the suture material. So mount it about 1/3 of the way along. So I'm going to briefly run through knot tying. So I'll just do this bit quite quickly, and we'll tie this first knot, and then I'll go on about suture placement in a second. So I've put the needle down, put it off to one side safely. You go once, twice clockwise, and you lay that knot down flat. You then go back anti-clockwise, and then one throw again clockwise. Then you need to cut your suture. Okay. Handling your needle again, do it with forceps, not fingers. So I'm going to show you a little bit more about suture placement. So this is about 3-4 millimeters from the edge of the wound. Note, I'm not holding it right at the edge here. I'm holding it a little bit away so I can see the tissues there. And we'll just go through at 90 degrees. And note, I've rotated my hand to take that out. And again, try and make it equidistant. Come through and We'll do the knot tying again, once, twice clockwise, anti-clockwise, put the knot over to one side, and again clockwise. And cut your suture. Now a little bit about needle safety. If you're going to put the needle down to come back to use it again, do it like that so that the point is not going to injure anybody. Now, just to make things a little bit clearer, what I'm going to do is alter the angle. So it's once, twice, grab, once the other way, pull your knot over to the side, and a third one to lock it. Cut your sutures about 6-7 millimeters in length, basically so that somebody can grab hold of them and take them out easily later on. Okay, and we'll just speed up. Notice on this one I'm cheating, I'm taking them just all in one together. Note the way that I keep crossing my hands. We're moving on now to look at the vertical mattress suture. This is an extremely useful suture which can prevent inversion of the skin edges like this. Generally, when you're trying to suture a wound, you want the skin edges everted. If you end up with inverted edges, you have a broad, ugly scar. So the simple mattress suture is a very useful technique to be able to do this. You start again putting the needle through the skin at 90 degrees, slightly further out than you would do for a simple suture. So through the skin at 90 degrees, further away than you would have done for a simple suture. And I'm now going to mount the needle backhand, that is to say, bring it through the skin in the opposite direction. You go through the skin very close to the edge of the wound, bring it out between the dermis and the epidermis. Notice I'm doing each part of the suture separately. If you try to do it all in one, you'll end up with tearing of the skin. through between the dermis and the epidermis, very close to the edge of the wound, less than a millimetre away from the edge, and tie. And you can already see with just the one suture how it's beginning to evert the wound. You don't have to close all of a wound with mattress sutures. You can do a mixture of mattress sutures and simple sutures. The main aim of the mattress is to bring the tissues together with an everted skin edge. Again, mounting the needle about 2/3 of the way along, through the skin at 90 degrees. Note the way I'm rotating the needle holder. Pick up with the needle holder and rotating the needle through the skin. And again on the other side. So that's 2 sutures completed. Note the safe management of the needle. I covered the sharp end of the needle in the jaws of the needle holder, and therefore it can't do a needle stick injury. So looking at the old wound, you will see that the sutures are placed nice and evenly, and that the sutures are well spaced. The distance between 2 sutures is roughly the distance between the entrance and the exit point of a suture placement. You'll see that with a simple mattress suture I've been able to space them slightly further apart because the suture bite is slightly bigger. We're now going to move on and just do a couple more sutures, and that will be the wound closed and finished. Bringing the needle out between the dermis and the epidermis and very close to the edge of the wound. If you don't do this, you'll end up with a wide gaping wound with the dermis exposed, leaving a wider, uglier scar. Finally, I want to show you about the tension of the sutures. The aim of a skin suture is to bring the edges of the wound together gently with a good blood supply and no tension. So if you have too much tension, you end up with scarring, and you don't want to pull the tissue together like this. You can see how it's puckering the skin, and this will be painful for the patient and leave an ugly scar. The only thing we can do here is to remove that suture and start again.